So we're about 2 minutes in. This is a young patient. We're doing a third laser therapy session. Came in with posterior tibial tendonitis, and we've done one. He's fairly active. What do you, football and basketball? Track, and do you play basketball and football too?
Yes.
Okay. So was having symptoms, especially where I'm at right here in the plantar fascial area, and also in the navicular area. And so we, of course, because of his presentation is not significant and is not chronic, hasn't been going on for longer than a year, 6 to 9 months. Anyway, so we decided to go with laser, which is indicated by FDA, approved by FDA for pain management, decreases inflammation, and increases energy within the cells we're trying to get to heal. Anyway, so this is his third therapy session, and how much improvement percentage-wise, I know it's hard to quantify, to say exactly, but if 0 is nothing and 10 is, if 0 is no improvement and 10 is complete improvement, where would you say you are as far as improvement?
I'd say I'm about at a 7 on improvement. 7?
Okay. So your pain has gone down 7 points or gone down 3 points? Which one would you say?
7 points.
7 points. So about 70% improvement. We're just third treatment. So this is really a great option. Initially when we started, you can see I marked out some of these areas. These are some areas where he was having some symptoms, some pain. So here in the navicular area, the plantar fascial area. And when I do these, I like to kind of stretch out the plantar fascia so we can get penetration. Again, the laser is just light and it does a lot of things. It penetrates the skin several centimeters, and by doing so, it increases the energy within the mitochondria, which is the energy producing part of the cell. And then the cell uses that energy to increase healing, to facilitate regeneration and healing. And the other thing the laser does is it increases blood flow to these areas that are being penetrated and treated. And as you know, blood flow will bring the nutrients that are necessary to nourish the cell and facilitate healing. And any other thing that the laser will do, we don't really know how it does this, but it does. It has an anti-pain effect. What that means is the nerve cells in this area, is it getting hot? Okay. The nerve cells in this area the laser is able to interrupt or slow down the transmission of pain stimulus from these cells to the brain. And so by doing so, it has this analgesic or anti-pain effect that actually a lot of people can feel from first treatment. So like I said, this is his third treatment, and he said, as you heard him, about 70% improvement. So I usually go up to about 25 watts. I use 25 watts for power, and we climb up in energy up to 15,000 joules. So right now we're about halfway done, and we are at about 7,000 joules. So I'm going to pause about halfway here and feel some of those areas we've marked out previously. And you can honestly tell me how bad is this? Let's start with this. How bad? How's that feel?
It feels better.
Good. How about here?
No pain.
As I go down in here?
No pain.
Okay. And finally back in here.
Still a little bit right there.
Okay. Well, so again, that's the idea. So we palpate. You can determine if you've given enough dose of the energy in this area by palpation, by feeling. So these areas, and what I would do in those areas is I just kind of slow down the therapy session and focus in that area. And again, this does generate some heat. There's going to be some differences in sensitivity from person to person. And so some people, I have to move it, really fast so they don't feel the heat. And some people, like myself, when I've tried this on myself, I can move it really slowly and I can actually tolerate. So it varies from person to person. You just have to be able to talk to the individual and just have a conversation, see how they're feeling. So we'll focus in this area that he was having some discomfort. So even with running and doing this with track, How much pain are you having with track now versus before the treatment?
I'm not in track no more.
Oh, you're not in track anymore?
No.
What activities are you doing now that you
I'm just running, but before, like, when I'd start running, my foot would really start hurting.
Okay.
But now I can run like 3 or 4 miles pretty easy.
Really? Good for
my
you.
foot hurting.
Good for you. Actually, I ran track in college. I did 100 and 200 meter sprints. That was my main event in college. I don't do that anymore, of course. But it's amazing. Whoever can run long distance, that's fantastic. All right, so I'll focus in on this one again. Let's pause that and see, and then we'll continue up until, how's that feel now?
Good.
Actually, this is where we were. How's that feel?
It's good now.
Good, okay. So we keep on going. So basically we won't run with the rest of this. I'll just finish up the treatment. But this is basically one of these options that, like I said, for individuals who are needle shy, you don't want to inject them, or they freak out by just the thought or the word injection, this is a fantastic option. Of course, if somebody is not a surgical candidate, you don't want to consider surgery for, it could be because of work, they can't take time off, or it's expensive, or maybe health reasons prohibit surgical intervention. This is an excellent modality because it's FDA approved, 85% effective, and gives individuals the pain relief to get back to activity, enjoy their life, and stay active. So anyway, feel free to research it. You can actually go on our website. That's onefootandankle.com. You can check it out. There's a lot of information on that as far as laser therapy is concerned. And then just also do the research yourself. It's excellent for those individuals who are, like I said, having pain in the foot, ankle, leg, wherever, and don't want injections or surgery. Anyway, thanks for watching. Bye now.